Once we've understood how a pregnancy happens naturally, we also need to understand how a pregnancy happens through an IVF cycle. In the IVF cycle, the purpose is to make as many eggs as possible to grow up all together, then take them outside the body at the right time, fertilize them outside and form embryos. Personally, I would prefer these embryos to be transferred in the next cycle when the hormones in the body are much lower and much more physiological. That means more like natural. But we can also transfer the embryos in the stimulated cycle itself. How do we prepare for an IVF cycle? What are the steps of the IVF cycle? What is the IVF cycle that I prefer? This is what the content of the discussion is today. Let us talk about the preparation of the IVF cycle. You should and your partner should be in the best of health. So make sure all your blood tests are done and they are all proper. Especially focus on the thyroid, the sugar levels and the other hormone levels, both for yourself and for your partner. Once the reports have been seen and confirmed as okay by the doctor, you start taking some antibiotics, some antioxidants and some prenatal vitamins. What it does is it makes sure that in case you have any deficiency of any of these things, it is made up by this antibiotics, antioxidants and vitamins. Especially in men, we say antibiotic is necessary because many a times their semen sample contains infection which may prevent good fertilization later on. Also, along with the blood test and medications, you have to remember to make sure that you undergo the financial counseling to understand the cost implications and the consents that have to be taken and signed. So financial counseling and the consent and the psychological counseling. So this constitutes the pre-IVF for you. Once you have started on all these medications, the reports are all right, that's when you are put on contraceptive pills. Now this is a very common question that people ask me. If you are going for a baby, why are you giving a contraceptive pill? Please understand, a contraceptive pill will prevent your brain or the hormones coming out of the brain from selecting the eggs present in the ovary. So what is happening is, all the eggs in the ovaries are all there static. They are not growing up, are not being selected by the body. This helps us because when we withdraw the contraceptive pills and give a washout time of 4 or 5 days, when we start the injections thereafter, all the eggs that are available start growing all together. So then we have what is known as a concordant cohort, meaning all the eggs are of the same size right from the day one. If I were not to give a contraceptive pill, even then that's not a problem in major patients. But in some patients, the body might have already started selecting 1 or 2 of these eggs, and then when I start the injections, these 1 or 2 eggs are faster growing and the rest are lagging behind. This is known as a discordant cohort of follicles. Now what this does to us is, we have a problem trying to go the cycle either by the leading follicles or by the ones that are slow. Because if we decide the cycle on the basis of the leading follicles, then the rest are immature. But if we wait for the rest to grow up completely, then the leading couple of follicles might have become over mature and might have destructed themselves. So get the best harvest of follicles all together, we give you contraceptive pills. But this is to be understood in a lot of context otherwise also. If I give you contraceptive pills for a long duration, then the brain would stop functioning whatsoever, and then you'll require very high doses of FSH injection to make the eggs grow up, which is a waste of money. If I give you contraceptive pills for few days, then maybe the brain will not shut down and the follicle selection would still happen. So we need to give you the contraceptive pill at least for 10 or 12 days and maximum for 28 to 35 days. There is another role that we get to play when we give you contraceptive pills. So people who are working, who have a busy schedule, who are coming from outstation, for them it makes sense to plan the cycle with us immediately, because then we can decide, mutually decide actually, on which date to stop the pills and from which date to start the injections, so that you need not worry about taking leave and being absent from your work or finding tickets at the last moment, etc., etc. Only thing to remember about contraceptive pills is they have to be taken at the last thing in the night before going to bed, and these are very low dose pills, so they are not effective for more than 24 hours. Make sure that you take them at the same time every day, otherwise the effect may be lost.